Today, we're plunging into a real-world puzzle that, well, it perfectly illustrates why our topic is so incredibly crucial. Picture this. Thailand's first major gold mine, Chatri Gold, kicks off operations back in 2001. Fast forward to 2015, and alarming tests emerge showing elevated arsenic levels in the urine of local people. Now, this news hits hard. It leads to immediate mine suspension. It's a massive crisis, and naturally, fingers point directly at the new kid on the block, the mine. But here's where it gets really interesting. An independent study steps in. We're talking top environmental toxicologists, hydrogeology specialists. They run tests on control communities like 20 kilometers away from the mine, and guess what?
They found similar levels.
Exactly. Similar elevated arsenic levels there, too. The real culprit turns out to be, well, ingestion of arsenic-containing food. It was a pre-existing issue, totally unrelated to the mine's operations. The mine eventually got the okay to reopen, though it did later close for other reasons. Okay, let's unpack this. This case isn't just some fascinating anecdote. It truly highlights something fundamental before any major project begins.
It really does. It highlights the absolute necessity of understanding a place before you even dig the first shovel.
Exactly.
And that story perfectly sets the stage for our deep dive today into health impact assessments, or HIAs. And this isn't just about mining. It's a vital tool for any major development. Think new infrastructure, large-scale agriculture, even urban planning projects. What we're going to explore today is precisely what an HIA is, why it's so incredibly important for protecting and even improving community health, and how it systematically uncovers potential positive and negative health effects far beyond just physical illness.
So by the end of this deep dive, you'll have a crystal clear understanding of how incredibly complex health truly is in the context of these big projects.
Yeah.
And how a powerful tool like HIA helps us identify, anticipate, and manage those impacts effectively. We're going to dive into the nuts and bolts of it, drawing from the insightful sources you provided, hopefully give you a few aha moments along the way. Okay, so before we dive into the mechanics of HIAs themselves, let's talk about health. We often think of it as just not being sick.
Right. The absence of disease.
But for these assessments, our understanding has to be far broader. The World Health Organization, for instance, has a definition that's much more expansive.
It really is. They define it as a state of complete physical, mental, and social well-being.
That's a huge canvas.
It is. And that expansive definition is absolutely key because it then forces us to consider what we call the determinants of health. These are the many interconnected factors that influence this broad state of well-being. They generally fall into three main categories. First, we have the social and economic environment. This looks at things like person's income and social status. Higher levels are pretty consistently linked to better health outcomes.
Makes sense.
Education plays a huge role, too. A lack of it can contribute to poorer health, higher stress, lower self-confidence. Then there's employment, strong social support networks, family, friends, cultural traditions, and crucially, access to quality health services. All of these directly shape this category. Second, we look at environmental health factors. So here we consider the basics. Access to safe water, clean air, but it also includes the quality of workplaces. Do they promote a positive culture? Is there zero tolerance for discrimination? These things deeply impact mental health. And of course, safe housing, well-maintained roads, fundamental stuff.
Okay, social environmental. What's the third?
And finally, we examine a person's individual characteristics and behaviors. This covers genetics, personal lifestyle choices, eating habits, physical activity, smoking, drinking, and critically, how we cope with stress. Demographic factors like gender and age also influence the types of health challenges people might face.
Right, and when you map that onto a major development, like a mine, you can immediately see how it could swing things either way. It could improve or dramatically worsen these factors. On the negative side, a mine might put immense pressure on local water resources contamination, or just using up clean water.
Or create new problems.
Yeah, like inadvertently creating habitats for malaria-carrying mosquitoes. Or an influx of mostly male workers could unfortunately increase the risk of STIs. Dust is an obvious one. Then there are physical injuries, accidents, explosives, chemicals, even just heavy truck movement.
And as that Chatri example showed so clearly,
Without establishing good, solid baseline data before the project starts, things can get messy.
very messy. Projects can be unfairly accused if existing issues get worse or are just assumed to be their fault. That baseline is absolutely non-negotiable.
So that brings us to the tool itself, the Health Impact Assessment.
Precisely. An HIA is a systematic process of identifying the future health consequences, both positive and negative, of a proposed project or policy. What's fascinating here, and often overlooked, is HIA's crucial equity dimension.
Equity dimension. What do you mean by that?
It means it doesn't just look at the overall impacts on a population, it specifically considers how those impacts are distributed among different groups within communities. It helps us identify vulnerable populations because quite often health inequalities arise from, well, differential exposure to risks like pollution and unequal access to things like good housing, clean water, or education.
Okay, that's a critical layer. So what actually drives the need for these HIAs? Is it just ticking a box for regulators, or is there more to it?
That's a fair question. For some companies, maybe it starts as a requirement. A significant driver is definitely international funding requirements. The IFC, the International Finance Corporation, their performance standards, specifically Standard 4 on community health, safety, and security, often mandate HIAs for projects seeking funding. It's a non-negotiable there.
So follow the money.
Often, yes. But beyond that, you also see national health plans requiring them, internal company policies driving them, sometimes a genuine interest in identifying positive impacts for community development programs. And crucially, it's about mitigating those potential long-lasting negative impacts, like, say, pollution from transporting mine concentrates over long distances on public roads. That's a serious long-term community health concern.
Got it. And you mentioned this is different from worker safety.
Yes, absolutely. It's important to clarify that while mining obviously has significant occupational health and safety concerns for its workers, HIA is distinct. Its focus is squarely on public health and safety, the health of the surrounding communities.
All right, now that we understand what HIAs are and why they're so vital, let's get into the how. You said it's a structured process.
It is.
So where does this journey begin? What's the very first step?
It starts with a very direct question, actually. Step 1 is screening. We ask, should an HIA even be done for this specific project? It involves an initial assessment. Is there potential for significant health impacts? How many people might be affected, and over what kind of range? The core goal here is to figure out if an HIA can genuinely identify, address, protect, or even improve community health in this situation.
Could you give an example of where screening would be particularly important?
Oh, absolutely. A really stark example is the danger of asbestiform minerals. These can occur naturally in ore bodies or waste rock. Now, not all asbestos is the really dangerous blue asbestos, like the historical case at Whitnum Gorge in Western Australia, but these minerals still pose severe health risks. They can cause fatal diseases.
And they spread easily.
Incredibly easily. Their fibers disperse if disturbed, and they don't break down easily in the environment. So, community health risks pop up if these fibers contaminate areas where people might be exposed. This could happen even from early exploration like air drilling or later during blasting, crushing, and screening activities.
So screening helps catch that early. Does it involve talking to the community yet?
Not usually at this very initial stage. Often a rapid HIA, which is basically a quick desk study using existing information, can be used for screening. Community engagement comes next.
Okay, so screening says, yes, an HIA is needed. What follows? You need to define the scope, right?
Exactly. Step 2 is scoping. This is where you set the precise boundaries for the assessment. It's all about defining the terms of reference, figuring out the level of detail needed. It asks those crucial questions. What's the plan? What's the timeline? What are the key health issues we need to focus on? Who are the affected populations? What methods should we use?
And this is where the community comes in.
Absolutely. Unlike screening, scoping requires direct consultation with host communities. It's fundamental. It establishes the foundation for the whole HIA by identifying potential effects not just on the physical environment, but also the ripple effects on the social, cultural, and economic environments, and how those changes then flow into health impacts.
So you've screened, you've scoped. Now it's about the people.
Yeah.
You mentioned consultation and scoping, but engagement seems like it would be ongoing.
You're absolutely right. Step 3 is stakeholder and community engagement. And it's not really a single step, but an essential continuous component. It starts early, continues throughout the entire process. It involves creating a solid engagement plan, figuring out all the potentially affected communities, which can be tricky sometimes, and crucially, including people from the health sector.
What are the big wins from doing this engagement?
The benefits are enormous. You identify local concerns, environmental, social, economic, cultural, health, directly from the people living them. You tap into invaluable local expertise, that on-the-ground knowledge. It helps address issues before they blow up into major problems. And fundamentally, it ensures communities have a real voice in decisions affecting their lives.
Sounds vital, but probably not easy. What are the challenges?
It can be challenging, yes. Identifying truly representative community members is one. Another is introducing the HIA itself without inadvertently creating fear or negative perceptions about the project. You want to inform, not alarm. And providing feedback on findings, like baseline health data, without breaching individual confidentiality that requires careful handling. It's a constant balancing act.
Okay, engagement is happening. Now, before the project really changes things, you need that snapshot of before, baseline.
Step 4. Profiling or community health baseline. This is all about documenting the existing health status of a community before mining operations begin. It's critical for tracking changes later on.
So what goes into building that profile? What information do you actually collect?
A good health baseline survey really has 3 dimensions. First, it's a technical process. It involves analytical tools, sometimes quite innovative ones. Remember the arsenic story. Imagine trying to sample for metal contamination. Hair samples. Easy to get, but often unreliable due to external contamination unless you do expensive processing.
Right.
Blood samples. Reliable, but invasive, especially for kids. So in one case, like the Dairy Prima Mineral Project, they used a fingerstick method similar to rapid malaria tests the community already knew. Accurate, minimally invasive. It's about finding that sweet spot between scientific rigor and community acceptance.
Clever. What are the other dimensions?
Second, it's a social process. It needs active participation from community members and local healthcare providers to work. And third, arguably most importantly, it's an ethical process. You're dealing with privacy, with potentially raising expectations in the community. You need to ensure the survey topics are relevant to them, not just the company. And of course, data must be used properly, responsibly, confidentially. Ethical clearance is almost always required for these kinds of studies.
It's clearly a very broad look. What sort of specific health areas does a baseline typically cover? You mentioned environmental health areas, or EHAs.
Yes, the EHA framework helps organize it. There are quite a few, covering a wide range. For instance, EHA2 is vector-related diseases like malaria.
Which we touched on.
Right. Mining might create mosquito habitats, yes, but the project could also support local diagnostic services, actually improving malaria control. It's a potential two-way street.
Interesting. What else?
There's EHA4, STIs, and high-risk sexual practices. This is particularly relevant during construction phases, with a large influx of, often male, workers. Issues like transactional sex need to be understood and addressed proactively.
A sensitive but crucial area.
Definitely. Then EHA5 looks at food and nutrition-related issues. How might the project affect malnutrition? Maybe food prices inflate locally, or perhaps employment leads to improved nutrition. It also looks at things like anemia rates.
And contamination in food,
Yeah,
like
yeah.
the arsenic.
Exactly. That falls under EHA9, hazardous materials, noise, and malodors. This covers air pollution, water quality, waste rock management, specific contaminants like heavy metals. And this is where that market basket survey concept comes in. You analyze what people actually eat locally, like the staple rice in Thailand or Indonesia. Why?
To see if there's already contamination.
Precisely. Sometimes arsenic, for example, is already present in the food chain due to long-standing agricultural practices like pesticide or fertilizer runoff contaminating water used for irrigation. The market basket helps pinpoint these pre-existing sources unrelated to the mine. It establishes that true baseline so the project isn't blamed unfairly later. It's all about knowing what's already there.
That makes so much sense. Any other EHAs worth highlighting?
One more key one is EHA 12, health systems issues. This looks at the existing local health infrastructure, staffing levels, quality of services. A mining project often presents a significant opportunity to strengthen these, which benefits everyone.
Okay, so you've done the baseline, collected all this incredible data. What's the next step in the process?
Now comes assessment. This is step 5. Here, you determine the relative importance of the potential impacts you've identified, both the positive and the negative ones. A key part of this is understanding exposure pathways, essentially. How might people actually come into contact with potential contaminants? Is it through ingestion, eating or drinking, dermal contact, skin, or inhalation breathing? We then use various methodologies to assess the likely health impacts based on these pathways.
How do you judge how important an impact is?
Typically, you look at 2 main things: the magnitude of the impact, how many people might be affected, how severe could the effect be, and its likelihood, how probable is it that this impact will actually occur. These are often combined using a risk matrix, which helps prioritize which impacts need the most attention. And crucially, you always consider the distribution are certain groups, particularly vulnerable ones, likely to be disproportionately affected. That equity lens stays important.
Right. Assessment identifies the key risks and potential benefits. Then you need to act on that information.
Exactly. Step 6 is management. This is where the rubber meets the road, as you said earlier.
Huh.
It's about evaluating alternative actions and implementing concrete strategies to maximize the potential health benefits and prevent or minimize the risks identified in the assessment phase. This is where you actually do something.
Can you give some examples of what those management actions might look like?
Sure. They're really diverse. It could involve altering the mine design or layout itself, maybe siting potentially hazardous facilities further away from communities. It could mean implementing proactive community programs, providing access to clean water, running health promotion campaigns. Establishing clear codes of conduct for workers is vital, especially during construction.
We mentioned that with STIs.
Yes. Health screening for incoming workers, supporting public health surveillance systems, prioritizing local employment to boost the economy, training local health personnel. These are all common management measures. And importantly, funding these health programs isn't just charity. It can genuinely benefit both the community and the company by building trust and goodwill, fostering a stable operating environment. It can be a win-win.
Okay, management puts plans into action. But how do you know if they're working?
That brings us to the final step, Step 7, monitoring. This involves the ongoing tracking of both the positive and the negative health impacts over time.
And I bet this is where that amazing baseline data you collected earlier really pays off.
You are spot on. For monitoring to mean anything, that robust baseline data is absolutely essential. Otherwise, you have no point of comparison. You can't tell if things are getting better, worse, or staying the same. Interestingly, it's often more economical and practical to measure indicators of health effects like noise levels or dust concentrations in the air rather than trying to measure the health effects themselves, like hearing loss or asthma rates.
Why is that?
Because there can be significant time lags between exposure to something and the development of a health condition. Monitoring the exposure directly gives you an earlier warning. The good news is that most environmental regulations for air quality, noise levels, and water quality are actually designed specifically to protect human health. And when enforced, they're generally pretty effective.
So we've journeyed through the whole HIA process, from that initial should we even do this, screening right through to long-term monitoring. It's clear this deep dive has shown how health impact assessments are. They're not just another bureaucratic hurdle to jump over.
Not at all.
They're a comprehensive, ethical, and deeply human process for making sure major developments genuinely consider and address community well-being. It's about more than just avoiding harm.
It really is. It's also about actively identifying and seizing those opportunities for positive change, for strengthening communities. It paints a picture of just how interconnected health is with these large-scale projects. And this raises an important question for all of us, I think. Considering this complexity, the determinants of health, this intricate HIA process, how might applying these principles more broadly, even outside huge industrial projects, help improve public health overall? How could it help reduce those health inequalities we see in communities everywhere? What responsibility do different stakeholders, governments, companies, even individuals have in promoting this kind of holistic view of health, making it central to how we plan any kind of development?
That's a powerful thought to end on. This deep dive into HIAs really demonstrates how understanding complex systems and being proactive about health in its broadest sense can truly shape a healthier future for communities impacted by development. It's a powerful lesson in prevention, in comprehensive care, and maybe, just maybe, it makes you think a little differently about the next big project you hear about, whether it's down the road or across the globe.